Unions say hospital staff left traumatised and exhausted by dealing with the COVID pandemic every day will need time to recover before they can tackle a backlog of other critical and routine treatments. A recent study carried out by NHS providers, which is the organisation which represents hospitals in England, found many staff could resign if their well-being is not included in plans to cut waiting lists. It's been reported almost half of hospital staff have suffered symptoms of severe anxiety, depression, post-traumatic stress disorder or problem drinking. While the union UNISON represents, amongst others, some nurses, cleaners, porters, secretaries and catering staff in hospitals, Vicky Knight is the regional organiser for the union in the North West and joins me now. A very good morning to you, Vicky.
Morning, Paul.
What kind of pressures are your members under?
Well, I think firstly it's important to start by saying that NHS workers are and continue to go above and beyond to get us through this pandemic. I mean, the pressure on staff to keep us safe has been relentless while they put themselves at risk every day. And what we're seeing as a result of this is staff burnout, as you've said, high stress and anxiety levels, while staffing numbers are often frighteningly low as staff illness and absence from exposure to COVID and its effects really take hold. Staff mental health is being affected dramatically, and many members report sleepless nights, panic attacks, physical and emotional exhaustion. They're all absolutely at their limits.
Yeah, and you mentioned there about burnout. I know that they're doing very long shifts, that kind of thing. And also, there's no chance to switch off, is there? There's no chance to get away from this, really. And that must be very, very hard in the current environment.
Absolutely. It's terribly difficult for staff. I mean, they're doing their job against all odds. Our members are trying to give 110% to everybody in their care, despite this stress and fatigue. And low staffing numbers mean that there are really high demands for their time and for overtime. I mean, they are one team. This is very much a team effort. We have got staff from, as you've said, nurses, porters, paramedics, cleaners, A&E staff. Everyone is under sustained and immense pressure while they're dealing with this crisis. But I think the number one definite morale boost that our members require has got to be recognition of the work they've done and a significant NHS pay rise that recognises the value and the commitment of what they're doing. Hopefully also that'll attract new staff into the NHS and address the recruitment and retention issues that we're seeing there.
What's the situation with the pay rise at the moment? Because I was watching a government press conference, I think it was last week, and a viewer actually asked Boris Johnson why staff in Scotland were getting a rise and staff in England weren't. But he denied that was the case. What's your kind of perspective on that?
Well, there have been a number of submissions to a pay review body that's considering those submissions and are hoping to report around May time. But I think what's really important is that this government gets its act together and responds effectively to this pandemic. I mean, the NHS not only needs to give a pay rise to all of those workers who've given their dedication, commitment, and many have given their lives to managing this crisis. But what we need to see is real funding and investment in our NHS. We need to see more staff. We need to see high quality PPE. And of course, that includes a pay rise across the whole of the UK.
Lots of nursing staff as well are being taken out of their area of specialism, aren't they? So, for example, you might be a dental nurse who all of a sudden is working on a COVID ward. That must be really, really difficult to sort of compute.
Yeah, staff are really being challenged at the moment. And I don't think we can overemphasise the fact that they are utilising their skills and they are absolutely committing to upskilling on a daily basis to plug, the needs of the service. You can't overexpress how much our staff are giving to this pandemic and the toll that it's taken on their mental, emotional and physical well-being. In fact, what we really need to see is at the end of this, whenever that comes, the government investing and funding mental health and wellbeing services as a free ongoing provision to our NHS workers to deal with the effects of this crisis and the impact it's had on them.
Yeah, because that's not going to be a quick fix, is it, either? People will be living with this for years to come.
Absolutely. I mean, many people are already showing symptoms of PTSD. Many people fear going to work for fear of catching COVID, and many more fear of returning to work after they finish their shifts because they're worried they're going to infect their families and their loved ones. It's a horrendous situation, but our staff are committed and they're delivering every single day, Paul.
And as you said earlier on, Vicky, it's not just nurses we're talking about. It's easy to just focus on nursing staff and doctors, but porters, you know, if you're a porter at the moment, you must be, and I'm sorry to say this, moving a lot more dead bodies around every day and dealing with grieving relatives on a more regular basis as well.
Absolutely. That has to be the case, doesn't it? It's our porters, it's our cleaners. We wouldn't have infection control without our cleaners. We wouldn't have people getting to the departments that they need to be without porters. And as you've outlined, unfortunately, getting to their final destination without our porters. Our A&E staff, our ITU staff, everybody, our caterers, every single person in our NHS is delivering and being impacted equally by the tragedy they're seeing all around them, Paul.
And I've been contacted by several people who are waiting on surgery or waiting on quite important operations, that kind of thing, and have been waiting a long time. This backlog is only going to get worse, isn't it? And I guess it's the staff that are going to have to deal with that as well, which even when the pandemic is maybe over or reaching a conclusion, there's then another challenge to face, isn't there?
Absolutely. I mean, routine procedures don't go away. Surgeries don't go away. Cancer care doesn't go away during a crisis. It will all need to be dealt with. And while these staff who are already exhausted from delivering through the pandemic need to have their rest and recuperation and some proper holiday time, we're going to have those demands of picking up those routine clinical procedures and those surgeries and that cancer care. It's not going to go away, and it's only our NHS staff that can deliver that support and that care for the public.
And the problem is, at the moment, everyone's asking for more funding, though, aren't they? It does sound like NHS providers and yourselves are warning the government that more funding will be needed. How hopeful are you that you'll get more, and how realistic is that?
Well, I don't really think it's a choice, Paul. I think we have seen that the NHS has been overburdened and underfunded for a decade at least. And we're reaping the rewards of that right now, aren't we? We are over capacity. We cannot provide the services that we need to provide with the amount of staff and the lack of funding that we've seen government commit. So I don't think it's a big ask. I think it's a requirement if we are going to see our NHS survive this pandemic and be invested in and deliver for those people who pay their taxes year in, year out. I think it's a must.
Do you think this wave, this lockdown, is more difficult than the first one for staff?
I think it's been really difficult because staff had not had a break in between, because while lockdowns have been lifted, those routine provisions, those routine surgeries and clinics have opened again. So actually it has been relentless. One report described it as going in for a second tour of duty if you're a soldier. You've got all of those memories of the first pandemic and what you were exposed to and what you witnessed there. Then we had a second wave, and now we're going into a third wave. And staff really have not had a break. They are not rested physically or emotionally, and they're certainly not dealing with the traumas that they've witnessed on an ongoing basis for the last year.
OK, I shall leave it there. Thank you for joining me this morning, Vicky.
Thanks, Paul. Bye.
That is Vicky Knight there, who is a regional organiser for the UNISON union, who, of course, represent, amongst others, nurses, cleaners, porters, secretaries, admin staff, all in hospitals there. She represents the Northwest region on UNISON.